This video is brought to you by Straight Goods News, Canada's alternative online news source. Visit straightgoods.ca.
The other vision, the one that I adhere to, believes that healthcare is a public good, grounded on the Canadian values of fairness, equity, compassion, and collective action. And as I said in my Royal Commission report, Canadians view Medicare as a moral enterprise, not a business venture. We see it as a right of citizenship, not a privilege of status or wealth. Friends, if anything, that point of view is even stronger today in my mind than it was when I released my report. I note as well that it's stronger in the minds of Canadians. A poll released by Nanos Research, a very respected research organization, indicates just a few days ago support for public health care that has risen to a record high of 94%, a record high. I'll simply deviate from my written script to answer the question that I've asked myself, why 94%? I don't think it's ever been that high, Monique, before. And I think it's because there's all of this loose talk, or maybe not so loose talk, purposeful talk about the need to find, quote, new ways, which of course are the old ways, private enterprise, and thus the anxiety level and the concern level has risen. But for whatever reason, 94%. I thought that the accompanying comments by Nick Nanos, the company president of Nanos, were particularly telling. Here he said, and I quote, "There are two issues at play here. First, healthcare continues to be a top issue of national concern for Canadians. The second point is that right across the board, regardless of political affiliation or other demographics, support for public solutions in healthcare has increased over the past 3 years," end quote. And I believe that to be true. So tonight I want to focus on the current environment of the healthcare debate. I will present to you what I see as the challenges and the opportunities for fundamental reforms so that we can move beyond rhetoric to secure what is arguably Canada's most treasured and most important social program, and to place the debate over Medicare in its full context. To come to terms with the importance of the task which is ahead of us, I would like to also put Canada's values right off the top on the table. Because I see the choice that we as Canadians make about Medicare as one in which is fundamentally intertwined with our nation's values and its future. Every nation has a narrative. Canada's history offers a strong and rich legacy of success that has forged our country. It is this legacy of a shared destiny, as I describe it, that is key to understanding our young but dynamic history. And it is this same legacy of shared destiny that I would argue remains the roadmap to our future at home and abroad. For those like me who came of age in our prairie communities, the notion of shared destiny was key to our existence. The harsh, often snow-blown conditions and droughts and distance and isolation and small population forced us together like poplar trees huddled on a wind-swept plain. And so it is with other regions in Canada too, where geography and demographics may vary, but where we all learn to see survival and progress as a test of our ongoing ability to organize collectively and to remain united around shared values. And as we lived together and worked together and built together, this notion of shared destiny was transformed into the foundation of a great nation called Canada. And just like with today's other major issues, how we choose to inform our way forward and the set of values that we draw upon to shape our progress will ultimately become an expression of who we are as a nation. Friends, that is why the debate over Medicare is not just about effectiveness and efficiency. It is not simply about the irrefutable evidence showing that our single-payer public system delivers excellent health outcomes, which it does. The Medicare debate is not even just about basic Canadian values like equity, fairness for all citizens. Yes, it's about all these things, but it's also about something much more. For Medicare holds a central role in our narrative as a country, our shared destiny, that how we deal with it and social programs like it may very well determine the future of our country. or whether, in fact, we do make
more competition, more privacy, private enterprise?
It's interesting that this idea that more competition will reduce costs is still even out there in the conversation on healthcare, because it's not as if the jury is still out on this. The jury's in. The evidence is there. Study after study has shown us that for-profit and investor-owned care delivers higher cost, lower quality healthcare services. And these are international studies and national studies that are published in peer-reviewed academic journals like Paul Devereux's work, the Canadian Medical Association Journal, Vikram Commodore on nursing homes in the British Medical Journal, Neil Powell on dialysis facilities in the New England Journal of Medicine, Woodlander and Himmelstein in the New England Journal of Medicine, and here in Canada, Margaret McGregor and Lisa Ronald from UBC on long-term care clearly showed quality was lower and costs were higher. On the quality side, it's quite significant. PJ Devereux's study showed that investor-owned hospitals were associated with a 5% higher mortality rate post-surgery. You have a higher chance of dying after surgery in an investor-owned hospital. And, you know, same with dialysis clinics associated with excess deaths. And, you know, also on administrative costs, Industry Canada found that the public system has 2.1% admin costs, and the private healthcare system 6.5%. So more than triple the administrative costs on the private side. So yeah, it's interesting that this conversation is still around. The public system benefits from bulk purchase, lower administrative costs, lower CEO salaries, better efficiency, transparency, accountability, even flexibility. And still that conversation's alive. And it's really time to move beyond it. In fact, the Calgary Chamber of Commerce, this is an interesting anecdote, was putting a submission forward in Alberta for we were writing our own health act. It's very cocky of us. Alberta decided they needed their own health act. And the Calgary Chamber of Commerce wrote a submission that was on behalf of the private for-profit surgeries. And they said they needed a leveling of the playing field because the public sector benefited from economies of scale and bulk purchase that the privates couldn't, and it wasn't fair competition. And I'm quoting their submission directly. They asked for a, quote, leveling of the playing field, which translates, of course, into a subsidy. So, and we also have the private surgery in Calgary that I can talk a little bit more about later that gives us some good
cost, but
data.
it's an efficiency cost, and it's one that does not very often get raised. The more of our health care that's in the private sector, the more scope for insurance, private insurance. And the more that we have private insurance, the probability increases that that's going to get tangled up in labor arrangements, in collective agreements, for example. And one of the things we know about that, and one of the real strengths of the Canadian system that we often do not appreciate, is that we have a very clear firewall between access to health care and access to health insurance for the most part. I mean, we do have private insurance at the margins in Canada, but we have pretty much a strong firewall between that and employment. When you get into a system where a significant portion of your expenditures are private, a significant portion of those are subject to private and are covered by private insurance, people get locked into jobs, and that leads to huge inefficiencies in the labor market. And that's a benefit. I mean, Roy Romanov talked about Medicare as a Canadian value, which to me is the preeminent thing. But that's a clear economic efficiency benefit to a Canadian-style system versus a market-oriented system.
So in the U.S., for example, there's very little labor mobility because people can't move their insurance plans.
Because all the private insurance plans refuse to insure against pre-existing conditions, and people with pre-existing conditions are then locked in.
Yeah. We're talking money, so let's talk money seriously. I hear over and over again, I'm sure everyone in this room has read in the August Globe and Mail, that healthcare is bankrupting us. We can't possibly afford it. We've just crossed the $200 billion a year barrier. So I want to ask, can we afford it? $150 $141 billion in public spending, $59 billion in private spending. Does it have to stop? Who wants to? Diana, do you want to start? 12% of GDP, is that too much? Are we doomed?
It's interesting when some of the economists and writers on, that say the sky is about to fall in, so Dodge and folks like that, they talk total spending, but then when they talk about controlling spending, they only talk about controlling public spending. It's really interesting. They never talk about the out-of-pocket side, and that's the side where the costs are going up the most. Public spending, and I think you'll talk a little bit more about that, has been very stable as a percentage of GDP. And if you're an emergency room doctor living next door to someone on social assistance, you wouldn't say your spending was out of control because it was higher than your next door neighbors. Of course you have to talk about spending relative to income, and that's why we have to talk real dollars. Also, the population grows. As that grows, our tax base grows. We have to talk about spending on a per capita basis, real dollars, inflation controlled, and relative to the size of our economy. That's a real conversation about sustainability. And when you put it in those terms, it's barely gone up. Public spending especially has only increased slightly as a percentage of our economy. So it's, in that respect, it's totally affordable. But private out-of-pocket spending is an area where spending's out of control. And I have a great example of this, and it ties back to what we were just talking about on the private side. A friend of mine is an optometrist in BC, and when they were delisting vision care, he was devastated because he knew only half of Canadians have medical coverage through their work. So he knew he was going to lose half of his clients. And then a light bulb went on for him because he realized that the cap was going to come off what he could charge them. Because he wasn't going to be under the public system anymore, he could charge whatever he wanted. He could charge them twice as much, see half the patients, and windsurf in the Hood River twice as much. And that's very illustrative because vision care costs skyrocketed after it was delisted. Dental care, which of course was never in, though Tommy Douglas wanted to see it in, costs go up well in excess of inflation year over year. So when we talk sustainability, we need to talk about controlling costs, out-of-pocket costs for individuals, for long-term care, continuing care, home care, pharmaceuticals, dental, vision, and all the rehab therapies that were de-insured and delisted. And to control those costs, the public system is the best mechanism for controlling costs.
Okay. So, go ahead. So on your point, per capita costs, again, I go back to the Kai-Hai information that came out last month. Per capita costs in Canada, $5,614 per person for healthcare. That works out to $15 a day per person. So maybe, a lot of people spend that on what? Their Starbucks double lattes every day. So a little bit of context on how much it costs.
I do think it's a question, it's fundamentally a question of values. Where is the balance, the so-called balance between public payment and private payment? And I agree, I'll second strongly what Diane said about the delivery systems and who provides care. I think if you look at, where's the private funding for healthcare going? Well, it's going to dentistry, it's going to pharmaceuticals, it's going to longer-term care. And I think if, I'm particularly concerned that we see increasing suffering on the part of elderly people and people with chronic illnesses who are being subject to more and more coercive tactics to move them out of hospitals, out from the umbrella of Medicare, when there isn't adequate care for them, when they're at a point in their lives when their incomes are fixed, when they don't have a lot of options to pay privately, at the same time as pensions are more under threat. I don't think that that's the way that we want to plan the future, and so I think that we have to. I think it's an obligation for us to work hard now to create a long-term care system that works for Canadians, that addresses those that suffering and that growing inequality in access to care. I think it's fundamental. So I would pitch, I mean, you could choose any of them. They're all important. Dentistry is important. Pharmaceuticals, obviously, a public pharmacare plan could save a lot of money. But in addition, I think we need to look at a long-term care strategy for Canada that addresses the needs of the aging population in a way that that actually stays true to